Good evening, everyone. Let me start by thanking you for coming here today and taking time out of your busy schedules and visiting with us. I'm an interventional cardiologist, so is some of my colleagues, Dr. Siddiqui and Dr. Abbas, and we take care of blockages in the heart. We fix hearts, sometimes in the middle of the night when people come in with heart attacks, sometimes more electively. What I'm going to do is talk to you about how we can prevent heart disease. We take care of heart patients, but obviously, if we can prevent individuals from getting to that stage where they develop blockages, the outcomes are going to be much better. Now, I see a lot of young faces in the crowd too, and one of the things I'm going to emphasize, heart disease starts very early in life, probably in our 20s and 30s. We don't have chest pain or some of the symptoms, but takes time. I'm going to start by sharing with you some of the data on the top things to be aware of. And some of the diseases you'll hear about here are common diseases. Hypertension. Close to 77 million US adults have high blood pressure or hypertension. That's about 1 in 3 or 1 in 4 adults. Very common. A lot of individuals have high blood pressure. Cholesterol. 100 million, close to, again, 1 in 3, 100 million adults more than 20 years of age have total cholesterol level more than 200, or total serum cholesterol. About 40 million have serum cholesterol more than 240. Diabetes is common, particularly in this region of the United States, or the border region. Diabetes is far more common, probably about 1.5 times to 2 times more common. But overall, about 19 million US adults, about 1 in 10 have diabetes. Probably about 7 million don't know they have diabetes. They may have it. Diabetes is a silent killer. And unless somebody goes to their doctor, gets a regular checkup, and gets their blood sugar tested, may not be aware. And about 80 million have prediabetes. So they are somewhere in the incubation phase where they're going to develop diabetes in the next 3 to 5 years, and there are certainly steps that one can do to prevent that from happening. Physical activity. Only 20% of adults meet the guidelines for physical activity or regular exercise, which is about 3 times a week doing something physically active for 20-30 minutes a day. And if you look at children, only about 1/3 or 37% are physically active to meet guidelines. Part of the culture has changed from sports and games to video games or being on the computer. Diet, less than 1%, so 99% of us typically don't eat right. And we'll talk about that in a little more detail. Nobody expects everybody to eat healthy every meal of the day. But you have to be balanced in life as with everything. You can set up boundaries that you're going to eat out once a week. You're going to eat red meat or burgers or something X amount times a month, but overall, trying to adhere to a more reasonable or balanced diet. Smoking is still a problem, also in this part. Texas is somewhere in the middle. New York has a lowest smoking rate, but about 20% of average of adults are smokers. 17.5% women are smokers, and in this region the smoking rate is about 23-24%, a little higher than national average, but probably not as high as maybe some other areas like Louisiana where there's 27-28%, or Kentucky. Body mass index. 2/3 of the US adults are overweight, and again that has implication for heart disease, stroke, and many other diseases. What is disappointing to a degree that if we look at what has been happening over the last 10 or 20 years, there has been relatively no changes in prevalence of either high blood pressure, smoking, diabetes, and overweight. So we haven't really changed much over the last 10 or 20 years, even though we know that all of these factors would lead to heart disease or decreased quality of life. Let us go back, having looked at the big risk factors: high blood pressure, high cholesterol, overweight, smoking. What if each of us had a guide that would guarantee us a longer life, that would prevent heart disease, which would include heart attack, stroke, blockages in the legs, to feel stronger, healthier now and for several decades later, to provide a better quality of life, to invest in relationships, life goals. If health is not good, usually nothing else works well, whether it's jobs or other relationships. What I want to share with you is how to embrace simple steps to build healthier lives free of cardiovascular disease and stroke. The goal is to improve cardiovascular health of the entire country, but we are focusing in El Paso. By 20% reduction in cardiovascular death, cardiovascular disease, which would include heart attack, strokes. Life Simple 7, what are they? Know your blood pressure. We'll look at it in detail. Exercise. Be cognizant of heart health, cholesterol. Eat right. Exercise. Do not smoke. And for those individuals, 20% individuals who do have blood sugar, to again control blood sugar, work with your physician, regularly do checkups. And today, diabetes is a very treatable disease. We have new medications that very few people need to go to insulin if treatment is started early. We have many options, but you have to take your medications regularly. You have to follow particular dietary patterns within balance. And if you do the right things, diabetes is very manageable. I think most of us know what it takes to save lives, but heart disease and stroke are still the leading cause, the number one cause of death in this country, in this region, whether it's Texas, El Paso, or New York, or St. Louis, Missouri. I think we know the facts, but it's still difficult to embrace our best health potential. There is extensive research that if you reach cardiovascular wellness goals by age 50, so if you could do these 7 steps by the age of 50, you can live another 40 years up to age 90, relatively worry-free from heart disease and stroke. So again, what are those wellness goals? Life Simple 7. And anyone can reach them. These are not difficult things to do. I'm not asking you to climb mountains, go run a marathon, or do something that is very difficult. If you go to the American Heart Association website, which is a free website, I think you can get to it on your computer, laptop, smartphone, iPad. You can use this life check system. What you do is answer questions about Life Simple 7. They'll ask you about your blood pressure, your blood sugar. They'll ask you blood cholesterol, whether you smoke, what's your weight, how active are you, what's your diet. They'll tell you, give you a personalized, individualized action plan. And they'll give you a score, 0 to 10, based on the information. And the lower the score, obviously better, but it will tell you the steps that you need to do based on your current lifestyle, based on your personal blood pressure, blood sugar. And you can just go to if you Google My Life Check, it'll take you to the American Heart Association website. You can print your results, save it electronically, and 6 months later, once you have made those changes, you can come back and retake. Once the blood pressure is better controlled, blood sugar is controlled, and you can see, the system will tell you how much you're likely to reduce your risk of heart disease. Blood pressure is very important. We saw that 1 in 3, ballpark 1 in 4 individuals, adults, have high blood pressure. It is the single most modifiable risk factor. There are things that we can change, modify. There are things we can't change. We can't change our gender. If you're male, may have some risks. We can't change our genetic makeup. or parents. That may have some bearing, life's sometimes not fair, and some genetic characteristics predispose to some diseases. But hypertension is modifiable. For anybody with hypertension, we have extensive list of medication. There's probably less than 1% of patients that cannot be controlled with blood pressure medications today. There is also surgical treatment for this 1 or 2%, but 98 to 99% of patients can be treated medically and can get good control of their blood pressure. Again, 1 in 3 have high blood pressure. A lot of them are unaware. You can go to your physician, you can go to Walmart or Walgreens or Sam's Club. They have free blood pressure checks. Just put your hand in. Most of you know blood pressure needs to be less than 140 by 90, but you need to check it. Again, it is one of the silent killers. A lot of times we see individuals who are unaware that they had high blood pressure. They come in with a stroke or heart attack. Could have been easily prevented. So again, you can go to primary care doctor, you can go to health fairs. There's a Walmart pretty much in every corner, every block area, and they have free blood pressure machines. You can go and check your blood pressure. Take action. Know what your blood pressure is, get treated. Know your numbers, track your progress, make sure that you know how well you're doing. Learn healthy habits for eating well and staying active. If someone has high blood pressure, there is interaction between diet. Eating less salt will control your blood pressure. Regular exercise will control your blood pressure. Cutting back on alcohol will control your blood pressure. So in addition to medications, there are things that you can do with lifestyle that can help control your blood pressure. Second thing we're going to talk about is active. And we have moved from as a society in the last 3-4 decades from being very active physically to being very sedentary. There's a joke at Duke University Medical Center that if somebody needs to go to the next building, they go to the parking lot, take their car out, and then drive to the next block rather than walk, maybe half a block. But that's kind of what our mentality has become. Europe is very different. There's more people on bicycles, bikes. They walk more. They do have less heart disease. So activity is important. Now, activity doesn't mean, for heart benefits at least, I'm not talking about bodybuilding or building muscles, but for heart benefits, exercise doesn't have to be very strenuous. If you walk 20 to 30 minutes a day continuously, has to be continuous so that the heart rate goes up, 3 to 5 times a week, you're probably getting pretty much the maximum benefit. There's a study particularly in women, elderly women. If they walk 10 minutes 3 times a week, you get very robust cardiovascular benefits. So again, exercise doesn't mean running a marathon, lawn tennis, or track, but anything you enjoy. Aerobic dancing, it could be walking, but has to be continuous activity because the benefits come from increasing your heart rate and keeping it there for a while. Take action again. Make your decision to get moving. Choose activities you can enjoy. That's very important. If you choose something you don't like to do, because this has to be part of your lifestyle. This is not a 3-month or a 6-month activity. So if you like something, if you like walking, or if you like swimming, or if you like aerobic dancing, listening to music, choose something that you can stick to. This is a lifelong activity. Cholesterol. Again, it is one of those things, unless you go get checked, one may not know that somebody has high cholesterol. The current guidelines, again, is everybody after the age of 25 should have their cholesterol checked. Prevention works best if started early. So somebody who has high cholesterol and starts treatment at the age of 25 is going to have much more benefit compared to the individual who found out at the age of 50, 60, 70. There is going to be much more robust reduction in events in an individual who started early because you're preventing some of these blockages. We talk about atherosclerosis as in the rust in the pipes. And the earlier you start with medication that will prevent these blockages, it is easier. It is far simpler far more effective to prevent new blockage or prevent new deposition than to kind of get rid of material that is already deposited. Should we control cholesterol? Because somebody who has too much cholesterol, very simply, is a major risk of heart disease and stroke, but also blockages in the legs and elsewhere, including in the kidneys, which can cause high blood pressure. Follow your healthcare provider's advice. You have to ask your primary care doctor. Typically, most primary care doctors would do it periodically, but ask him or her. Make sure you know your number. Make healthy food choices. And we'll talk about diet a little more detail. I'm not going to go very granular, but I want to give you a broad perspective of what a healthy diet is. And just like with exercise, I mean, if somebody who lives on just lettuce and greens and grains life may seem longer, may not feel that great. So everything in life, is balanced. I mean, you can eat meat, you can eat everything, but be judicious. Choose the better option more often than the other options who are not that healthy. Get active again. Exercise will reduce the bad cholesterol and will increase your good cholesterol. Now, women have an advantage. They typically have higher good cholesterol till menopause. That's why women tend to get heart disease a little later, but after menopause, it's a big equalizer. Once the hormonal effect is gone, their good cholesterol comes down, so they are at a higher risk. And again, things for women, if they start early in age when they're younger, they're going to get much more dividend because they are going to rack up that, increase that high cholesterol and prevent blockages in their blood vessels. Eat better. Variety of heart healthy nutrition keeps you living at your best health potential. So lots of fruits and vegetables, whole grain carbohydrates, fat-free, low-fat dairy products. So choosing milk, choose the low-fat or no-fat milk, or the 1% rather than the skim milk rather than the high-fat. Fish is very good. Omega-3 fatty acids, if you see in the television, you see a lot of ads. By and large, you get much more benefit from eating fish than you'd get from taking a pill of omega-3. So again, the natural source of a lot of these chemicals, the minerals, is much healthier than in a pill form. So again, if you like fish, there's a lots of variety. I think that's one way to reduce your heart disease. Things that are bad, soda. And I think, that's one of the things struggling, from a societal point of view. Every high school and middle school has these soda machines, and we start our younger population addicted to different kinds of carbonated beverages. But again, foods and beverages with added sugar, they increase diabetes, increase obesity. They will also have deleterious effects on cholesterol too. High in sodium, because that leads to processed food. So if you're eating meat, grilled or roasted meat is far better than processed meat. Sausages, salamis, and other things that have high salt intake increase high cholesterol. The pun is not, irony is not lost on me. There's actually also data that came out about a month ago that there are things in processed food, such as salami or hot dogs or sausages, that may actually directly also may have effect on increasing heart disease. I think diet is so important because, we eat 2-3 times a day, and I think that's an activity that we can control. This is from the USDA Center for Nutrition. And again, I'll highlight the key recommendations. Balanced eating and physical activity to reduce overweight, to reduce problems with obesity. Control total calorie intake to manage body weight. For people who are overweight or obese, this will mean consuming fewer calories from foods and beverages. Our society is obsessed with body image and body weight, and there are billions of dollars spent on weight loss. what works essentially is a combination of controlling calories and exercising. Really nothing else works. There are fat diets. You can do things like Atkins, eat a very high fat diet that fills you up, and you lose weight for 6 months. Everybody gains back weight after that 6 months. Mr. Atkins himself died from heart disease, and there was a big lawsuit in New York related to that. But again, life in moderation and eating right most days of the week, exercising is the key to ideal body weight. Physical activity, again, extremely important for modifying a lot of the risk factors. Somebody who is active is less likely to get high blood pressure, high cholesterol, diabetes. It is important that we do this not just as adults, starting early on. I think one of the major problems the United States is going through over the last decade is childhood obesity and childhood diabetes. We are seeing an explosion of type 2 diabetes, which we didn't see 30 years ago among our teens, adolescents, and sometimes children. Part of the culture, a lot of video games, a lot of sitting down, a lot of fast food, pizza, the culture of fast food culture. So this is not something just for adults, but very early on, we need to focus on eating right. And when it's a child or a teen, it's the parents who decide. If you instill in them the good diet philosophy and values, they're going to follow through. Overall, I think for most adults, getting a little granular, you want to consume less than 2,300 milligrams of sodium or salt. Individuals above the age of 51, they recommend 1,500 milligram or less. And it's about half of the US population, or anybody with hypertension, diabetes, chronic kidney disease should consume less than 1,500 milligram of salt. It's not that difficult. It sounds kind of intimidating, but if you look at the package content, you can figure out how much salt you're consuming. Less than 10% from saturated fatty acids, and we'll look at what that means. Less than 300 milligram per day of dietary cholesterol. So look at the food packages. Look at, just because it's sugar-free may not mean it's healthy. A lot of sugar-free ice creams particularly are very high in fat. The worst kind of fat you can consume is trans fat. The good thing is it's becoming less and less common just because of guidelines and federal policies. But you still get food with trans fat. But look at the package and make sure you look at the amount of cholesterol, look at the amount of saturated fat. Trans fat is the worst fat, and keep it as low as possible. Avoid it. Again, solid fats are worse, and obviously added sugars. Refined grains are something that are not that great. Much better are the whole grains, the whole wheat, whether you're choosing bread or tortillas. If alcohol is consumed, alcohol is a mixed blessing. So a little bit of alcohol is good. People who drink 1 or 2 glasses of wine is good because it increases the good cholesterol, unless somebody has liver disease or something else. But too much of alcohol causes high blood pressure. It affects the liver. It can cause other problems directly detrimental to heart disease. So alcohol in general is not bad if taken in moderation, like most things in life, except of course, pregnant women shouldn't be drinking, and only by adults of drinking age. I think this is a little bit of a repetition, but increase vegetable and fruit intake. When you're choosing vegetable, choose the dark green, red, and orange vegetables. They contain some beneficial chemicals. They're richer in vitamins. Consume at least half, preferably today. There's so much variety, and a lot of the whole grain food has become so much tastier. Consume at least half, but preferably most of your grains as whole grains. Take more fat-free, low-fat milk. You can get no-fat or low-fat yogurt, cheese, fortified soy beverages marketed as Silk or Walmart or Sam's Club brands. Those are pretty healthy. But frankly, you don't have to go for fancy stuff. Just the low fat or no fat milk products are as good as some of the more fortified soy beverages. Choose variety of protein foods, seafood, lean meat, poultry, eggs, beans, peas, soy products again, unsalted nuts and seeds. So when you go to the store, and those of you like nuts that are actually good for you, has omega-3 fatty acids, but make sure that they are unsalted. And grocery stores typically will have both of them. Typically the unsalted ones is in the bottom, right in front of your steering will be the more salted, the tastier nuts. So choose wisely again. Seafood and fish, very good. Choose protein foods that are higher in solid fats, or replace them with choices that are lower in solid fats. Use oils or liquid fat rather than solid fats. Potassium is good, actually has beneficial effects in lowering blood pressure. But want to choose things, vegetables, fruits, whole grains, and milk products rich in potassium and dietary fiber and vitamins. Banana is a great example. It's a great fruit for a number of reasons, but it's very rich in potassium. Oranges, again, are fresh squeezed orange juice. For women in the pregnant age, I think they particularly want to focus. I see a lot of young women here. Supply iron, so things that are rich, or foods that are rich in heme iron. Synthetic folic acid is recommended. That's one of the recommendations for additional vitamin in the pregnant adult. Seafood is great for women who are either becoming pregnant or breastfeeding. For pregnant women, don't recommend eating some of these fishes like mackerel and swordfish, shark, and tilefish because of some concerns about methyl mercury content, and iron supplements for the appropriate individual. So again, select an eating pattern that meets nutrient needs over time in an appropriate calorie level. So don't be too rigid with anything in life. I mean, if you are too rigidly following something, 3 months, 6 months, you're going to give that up. Choose balanced, with built-in that you are going to have a day that you indulge, or an afternoon that you're going to indulge and enjoy some of the things you like, but though in moderation. Choosing wisely means most of the days you're going to eat more fruits and vegetables, more seafood and fish, less red meat, more roasted, grilled food rather than deep fried food. Follow a healthy eating pattern, again, a balance. And obviously you want to be safe while cooking or storing food. In general, the recommendations are 5 or more fruits and vegetables daily, 6 or more servings of a variety of grain products, including whole grains, no more than 6 ounces of lean meat daily, and you can look at the weight, and it's lean meat. Enjoy at least 2 servings of baked or grilled fish weekly. So at least 2 meals of the 14, if you eat lunch and dinner, most of us don't eat fish for breakfast. So of the 14 meals, try to eat at least twice grilled fish. Use fats and oils sparingly, and use the ones lowest in saturated fats. The canola oil, olive oil, those are probably the better fats if you're using oils and fats. We are what we eat, and we choose ourselves. It also has bearing on our children. If this is what our diet is, our kids are going to grow up, and this is what they'll eat. Healthy foods and active lifestyle can be fun. I mean, you can make it fun. I'm not saying salad every meal of the day, but make it different. If kids understand, as we adults understand, that there are benefits, I think if someone is healthy, they are going to be more successful in relationships, at work, and a happier person. Their quality of life is going to be much better. I think this is one of the pyramids, modified pyramids, that came out, I think, about a year and a half ago. So 6 to 11 servings whether it's bread, cereal, rice, pasta group. So this is kind of the staple for most diets. But again, when you're choosing the bread, the cereal, choose the high fiber, choose the whole grains, whether it's you're choosing bread or tortilla or other grains, even rice, brown rice, or the higher fiber, the more whole grain is healthier. Fruits, bananas, pineapples, oranges, apples. Vegetables, more green, more colorful vegetables, tomatoes with lycopene, carrots. Sweet potatoes are very healthy compared to regular potatoes. Meat, poultry, fish, dry, beans, eggs, these are the protein content. And again, choose more fish, more white meat, turkey, chicken without skin, lamb, pork, beef are much higher in fat content. Milk, yogurt, cheese group, and again, even there, the reduced fat or the low fat or no fat are healthier. And fats, oils, and sweets probably are some of our favorite foods or desserts. Use sparingly. If you're making a dessert, again, choose the less fat of type of ingredients to make those desserts. Spend quite a bit of time on diet, weight. I think again I showed you that about 70%, 67 to 68% of individuals in our country are overweight to some degree. That has bearing, not just heart disease, but joints, other diseases. And losing weight is not easy. It is very difficult. A BMI of 25 is optimal, and as I showed you, about 67% are above that. Choose to invest your energy on the task, not feeling guilty. Sometimes it's not your control or your fault. Again, as I said, genes. There are genes or genetic factors that determine body weight. And you can see everybody in the family is obese, and there are leptins and adiponectins. There are things that you can or cannot do. Having said that, there are things you can still control. First of all, you need to know your BMI, and you can go online or anywhere. You plug in your height and weight, and the computer system will give you your BMI. Know how many calories you need. The weight loss plan, any plan that works is essentially integrates two things. And you see this on the television, different kind of diets they'll send you, but essentially it's calorie reduction and being more active. You have to expend the calories, or one has to expend the calories they're taking in. That's the only long-term plan that works. You have to engage in regular physical activity. It's very difficult to lose weight. And again, sometimes obesity prevents physical activity. So again, something that somebody can do, like swimming even, but slowly have to build it up. Weight loss pills is $1 billion industry in this country. Most of them have been pulled off the market at some point or the other. There's been cases with some of the older weight loss pills with actually causing valvular heart disease. Be very careful. Talk to a health provider and make sure your primary care doctor or somebody knows if you're taking these supplements. Television ads will tantalize you with, this works, and you sprinkle a little bit and you lose weight and looks like this person becomes a glamorous person within a few seconds. Miracles don't happen. They're trying to get your money, and be very careful of taking a pill that promises magical weight loss without talking to your physician. Smoking is the number one modifiable cause of death, even more important than high blood pressure, diabetes, and cholesterol. 2 reasons. It's associated with a very high hazard ratio, particularly in young people. If you look at individuals less than 40, the most important attributable risk for heart disease and stroke is smoking. It is addictive. It is something we can control. But for decades, the tobacco companies lied to us that smoking is not addictive. And individuals who are smokers know how difficult it is to give up smoking. We see all the time people quit for 3 months, 6 months, and then go back. I think it needs an incredible lot of willpower. It needs help from the family, spouse, or a significant other. But again, this is something that by eliminating, you're going to significantly reduce your health risk. Talk to your healthcare provider. Focus on the rewards, the benefits. In general, somebody who quits smoking at the age of 60 adds about a decade to their life. Somebody who stops smoking at the age of 50, probably longer. So this pays huge dividend. It's not just the length of life, it's people living longer. They're less likely to have major health problems, whether it's lung disease or heart disease. And again, I'm not taking it lightly because smoking changes chemicals in the brain. That's why we use antidepressants to help people quit smoking. There are medications like Wellbutrin, Chantix that actually modify brain chemicals. The interesting thing is all of those chemicals work while we take them. If you look at studies with this medication, the very expensive medication, people again go back to smoking after 3-6 months of stopping those medication. So I think those are temporary help, may get you over the hump, but you need incredible willpower. You need to make sure that your partner is not smoking. You're never going to quit smoking if somebody around is smoking. Your brain will crave for it and you'll forget all of that willpower. But work with your primary care doctor. There are things like nicotine patches, gums that will help you reduce the craving. There will be roadblocks, but you need to have that vision of the benefits you're going to get by being able to quit smoking. Blood sugar, again, a silent killer. High blood sugar encourages the growth of the plaque or the blockage in the arteries, increases the risk of diabetes, heart disease, and stroke. I think before we can talk about reducing blood sugar, again, diabetes is a silent killer. Somebody could have diabetes for 10, 15 years before they go to the doctor sometimes and find out. And we're seeing diabetes in younger and younger people. Again, if you haven't had a blood sugar check and you're above the age of 25, make sure. Most primary care doctors would check it automatically, but make sure you do have it checked and your blood sugar is normal. Make good food choices, commit to regular physical activity. The less the body weight, the less likely somebody is to have a diabetes. Maintain a healthy weight. And we certainly see individuals who come in with diabetes and they lose 20, 30 pounds and their diabetes is gone. They no longer need to take medication. Without a plan, there is an increased risk for heart disease and stroke. Failing to plan is planning to fail. So if you are not cognizant of all of these risk factors and you are not actively working to try to address them, it will significantly increase the risk of heart disease, stroke, illness, disability, surgeries, medications, treatments. Talk about quality of life, taking 3, 4, 5, 6 medications sometimes. If somebody has high blood pressure, high cholesterol, diabetes, reduced quality of life. With a success plan, every step counts towards your goal. I think, again, you can do it on paper. You can go to the website for My Life Simple 7. And you can know your score and you can reach your best health potential for yourself and for those you love. Together, we can build a healthier future, one heart at a time. Thank you for your attention.